Good evening. Welcome to Let's Chat. I'm so excited to be here tonight. We're going to be talking about breast cancer risk, knowing your risk, and learning what to do about it. So welcome. I am so excited about this. I used to work at a high-risk breast clinic, and so I learned out so much knowledge there. And so I'm very excited to be able to take this opportunity to share what I learned with you. This is an important conversation. Breast cancer is the most common cancer for women. 1 in 8 women will develop breast cancer in their lifetime. This is probably a fact that most of you know, but the thing that many of us don't know is, what is our personal risk? Are we personally at risk for breast cancer, or are we one of those women that are simply at average risk? It makes a difference. It puts us in control of our future and gives us options for things that we can do differently in terms of our screening if we know we're at risk, and we can learn about that. So I want to start out with a case example. A patient of mine, Samantha. She's a 54-year-old woman. She considers herself to be at average risk for breast cancer. She gets her mammograms once a year. She exercises regularly, tries to eat healthy. She doesn't have a family history of breast cancer, and thus she doesn't consider that she's at any higher risk than anyone else, and doesn't think that she thinks she's doing as much as she reasonably can do to reduce her risk for breast cancer. So we will revisit Samantha later on in the discussion, just to use her as an example of how this works. And so let's start going through a little bit of the risk factors for breast cancer. So one of the most dominant risk factor for breast cancer is simply being a woman and aging. So relative to age, our breast cancer risk increases, particularly in our 40s and beyond. And every year it really continues to increase until we hit our early 70s, and then it starts to plateau and then gradually decrease. So that's several decades of our life that we are at significant risk for breast cancer. Reproductive history is another category for risk. And so things like, how old were we when we had our first period? How old were we when we had our first pregnancy? How many pregnancies did we have, if any? What was the age of onset of menopause? So these factors either increase or decrease our risk for breast cancer. Breastfeeding, as an example, decreases our risk. Having a period before the age of 12, or waiting to have children until after the age of 30, those are examples of things that actually increase our risk for breast cancer. Breast density is another factor. The more dense our breasts are, the higher our risk for breast cancer is. Non-cancer related breast disease. So this would be, for example, if a woman were to have had a breast biopsy and the biopsy came back not showing cancer, but showing a non-cancer type of disease. An example might be something called atypical ductal hyperplasia. So this is a type of change in the breast tissue. It's not cancer, but it's a red flag for having increased risk for breast cancer. Women who have this have been shown to have about 4 times average risk for breast cancer. Having being of Ashkenazi Jewish descent is also a risk factor for breast cancer, as is simply having breast cancer in your family, and also ovarian cancer in your family. Prostate cancer and pancreatic cancer is also a consideration. Having a gene mutation in your family or for yourself, such as the BRCA gene mutation. Gene mutations are specifically something that impacts and significantly increases risk for breast cancer. A previous history of radiation to the chest wall. So, for example, a woman who's had Hodgkin's lymphoma in her 20s or 30s may have had chest radiation. And so this actually puts her at really high risk for breast cancer, particularly if it occurred in a young age group. So those risk factors are the set risk factors, so not things that we can necessarily impact. So the following risk factors are some modifiable ones related to lifestyle that we can actually change and modify over time to reduce our risk. One example is being obese. So having a body mass index over 30 is a well-known risk factor for breast cancer. And actually, even simply gaining weight after menopause can drive breast cancer risk. Having a sedentary lifestyle, so not getting regular exercise, is a really meaningful risk factor for breast cancer, and one that we can absolutely modify. Alcohol use is a risk factor for breast cancer. We used to think that it was fine to have up to 1 drink per day for women. Well, the latest research on this category actually shows us that any amount of alcohol can increase breast cancer risk. The more the volume of alcohol, the higher the risk. So there doesn't seem to be necessarily a safe amount. So moderation is key, of course, but it would be optimal to actually simply avoid alcohol use, particularly if you're at high risk. The other thing I want to make mention of, not necessarily because it's a significant risk factor for breast cancer, but because there is so much misinformation out there about this topic. And that topic is hormone replacement therapy. So there was a big study done called WHI, Women's Health Initiative. This study gave us really meaningful information to help us to know how to manage this. And so the results of this study showed us that women who use estrogen, for example, women who have had hysterectomies, who don't have a uterus anymore and are able to actually use estrogen alone without progesterone, that group of women, this study showed that there is no increased risk for breast cancer with these women. The other thing that this study showed us is that women who use estrogen plus progestin, and this study specifically looked at an estrogen called Premarin and a synthetic progesterone called Provera, and the results showed a very minimal increase in risk for breast cancer, meaning they were only 8 or 9 additional cases per every 10,000 women who used estrogen replacement annually. So this risk is very, very high. And so in general, a woman who wants to or needs to use estrogen to get benefits from it likely has much more benefit from it than risk. And overall mortality in this age group is actually decreased with women who take estrogen replacement therapy. So here we have all these risks. So now what do we do from it? So I've thrown all this information at you, so let's try to make it useful. So, one of the things that we do that helps to calculate the meaningfulness of all of these risk factors is to use a risk calculator. And these calculators give us a rough estimation for breast cancer risk. So there's a calculator called the Gail Model. That's a fairly simple calculator that uses information like your age, your family history, whether or not you've had breast biopsies, your breast density, and a couple of other things. And it spits out a measurement that gives us an estimate for lifetime risk for breast cancer, as including a 5-year risk. There's another risk calculator called the Tyrer-Cusick. And this one's similar to Gail. It's used a little bit more commonly in the clinical setting. It's what I use in the office in addition to the Big Gail model to help me to kind of look at all these risk factors and tally it up and give a woman an estimation for her risk for breast cancer, because some of these risk factors are weighed more heavily than others. And so it really takes a risk calculator to give us an estimate. And so typically we get a number that tells us your risk. And so average risk is 12.5% for any age group. So during her lifetime, a woman has a 12.5% likelihood to develop breast cancer in her lifetime. That's average. And so what these risk calculators are really aiming to do is to find those women who are high risk. So high risk is defined as 20% or higher lifetime risk for breast cancer and a 5-year risk that's higher than 1.7%. And so these risk calculators can be really useful to help us really categorize which woman is average risk and which women have higher risk and can consider enhanced screening and other options. And so what does it mean if you're high risk? So if you're you learn that you are at more than 20% lifetime risk, what does that mean? I mean, does it matter? Well, it does matter, because if you're at increased risk, it does make you a candidate for enhanced breast screening. So there are additional breast imaging tests that you might want to consider having, and you are actually recommended to have those. It also gives you options for medications that can be used to lower breast cancer risk. And so it's a meaningful information to have to be able to discuss with your medical provider about what are the optimal ways to have screening done. So let's talk a little bit about the breast imaging, what's out there and who gets what. And so breast imaging, most people are most familiar with mammograms. Mammograms are the gold standard for screening for breast cancer. So it's a picture of our breasts that really looks for shadowing or changes that may be suspicious for breast cancer. All women at all risk levels should start annual breast screening with a mammogram at age 40 and beyond. Some women, if they're determined to be at high risk, and for example, if breast cancer started much, much earlier than age 40 in her family, she might even be a candidate to start it earlier than that. But average risk women typically start at age 40 and have that done annually. 3D mammograms, or otherwise known as mammogram tomosynthesis. This is a special type of mammogram that it's like a high definition mammogram. So it makes the mammogram a photo that much easier picks up changes that could indicate breast cancer. So 3D mammograms or tomosynthesis are particularly useful if you have dense breasts, and they're also recommended for those women who have higher than average risk for breast cancer. Breast MRI is another type of imaging. It's really indicated only for women who have had these breast screenings assessments and have been found to be at higher than average risk. So women who have a 20% or higher lifetime risk for breast cancer, breast MRI is an additional study. And this is a different type of study than a mammogram. It's a study where IV dye is injected, and we really look at more the architectural makeup of the breast and how the dye absorbs, and looking for whether or not there's abnormalities based on that. Breast MRIs are a super sensitive test. They're not an appropriate test to do for average risk screening. So they're highly sensitive, but less specific, and so they're going to find more problems. And if we mainly focus on women who have higher risk, otherwise we would be doing unnecessary biopsies on women if we did it on average risk women as well. Breast ultrasounds are typically used in specific instances more as a diagnostic test. They're not currently recommended routinely for all women to be used as an additional screening, though. So that's a summary of breast imaging. The other topic I want to talk a little bit about is genetics. Who's a candidate for genetics? And so when we're talking about genetics, only about 5 to 10% of cases of breast cancer are related to a gene mutation. So by gene mutation, in this category, we're talking about things like the BRCA gene mutation, BRCA1 and BRCA2, or BRCA. So this gene mutation is a mutation. If it's inherited in your family, it can significantly increase risk for breast cancer in the realm of 55 to 85% lifetime risk for breast cancer. So if there are numerous members of your family who have breast cancer, or if there's a pattern of cancer in your family, you may be a candidate for gene testing. It's outside the realm of this discussion for me to go through all of the criteria to define who might be a candidate for genetic testing, but there are about 5 to 10% of cases of breast cancer that are related to this gene mutation. And ways to get testing would be to discuss this with your physician. Many times it can be ordered in the office or a referral to a genetics clinic to discuss this in more detail. Why is it important? If you have a gene mutation, depending on exactly which mutation you test for, it can impact significantly how you're screened. The BRCA gene mutation, as an example, you are a candidate for much enhanced breast screening, but you also are a candidate for breast surgery. For example, a prophylactic mastectomy is a choice that many women with the BRCA gene choose to have done in order to reduce risk for breast cancer. And in addition, they have the option to also remove ovaries to reduce the production of estrogen. And so if you have a gene mutation, it's really important that you know that. So I'm just looking over here to see if there's any comments or questions. And so far, I don't see that there are any. Feel free to pop those in if you have questions. Let's go back to our case. So with Samantha. So now that we have reviewed many of these risk factors, let's go back to Samantha and review in chatting more with her what we learned about her. So in chatting more, Samantha told me that she entered menopause or started menopause at age 54. She had her first period when she was 11. So that's in an early stage. So that's actually can increase her risk a bit. She did not have children. So actually women who have never had children have a small increased risk for breast cancer simply as a result of that. Looking at her mammograms, she had extremely dense breast tissue, so that would increase her risk. And talking a little bit more about her family history, we actually discovered that she has an aunt who had ovarian cancer at age 44. So we did a risk calculation on Samantha, and using both the Gail model and the Tyrer-Cusick ended up giving us a score of 25% lifetime risk on Samantha. So just at face value, we might not have guessed that Samantha was high risk, but in gathering a little bit more information about these risk factors and using the risk calculator, she indeed is at high risk. And so she's higher than 20%, and she's a candidate for adding to her annual mammogram. She's a candidate to add an annual breast MRI to increase our screening accuracy a bit. She also could discuss with her physician the pros and cons of using an estrogen blocker medication to reduce her risk for breast cancer. She ultimately did not choose to do that, but that is a discussion to have. And so Samantha was very happy to learn about her risk. It was not used as a scare tactic. She used it as more as a motivational tool. It didn't induce fear for her. It allowed her to more sit in the driver's seat of her future health, and actually acted as a motivator for her to really look at her weight, look at her eating patterns, look at her exercise, and really plug in to maximize what she was doing for herself to really lower her risk for breast cancer over the years. So this is a good example of how knowing your risk and knowing what the risk factors are can make a difference. So let's talk next a little bit more about risk modification. So some of the risk factors, as I said, are things that are set. We can't change our family history. We can't change necessarily our breast density, but there are things that are modifiable, and those include things like lifestyle habits. So the three major categories of modifiable risks are medications, surgery, lifestyle, and nutrition, and we will talk about all four of these. Let's start with medications. So for women who are in this high risk category, if you are determined to have a higher than 20% lifetime risk for breast cancer, there are medications that you could discuss the risk versus benefit of with your medical provider. These are medications in two drug classes. One's called SERM, and which stands for selective estrogen receptor modulators. This is, for example, a drug called tamoxifen. This blocks your estrogen receptors and thereby lowers your lifetime risk for breast cancer when taken for about 5 years. There's another category of medications called aromatase inhibitors. These medications block the conversion of pre-hormones into estrogen, so they dramatically lower your blood levels of estrogen and have been shown again to lower your lifetime risk for breast cancer by 50%. There's risks and benefits to these medications, and so it would need to be individualized and determined if that would be a good idea for you or not. And again, these are specifically for women who are at high risk, so that 20% or higher category. The second category is surgery. So surgery is really only indicated for that very highest end risk. So for those women, for example, who have tested positive for the BRCA gene, those women are candidates to consider surgery, as I mentioned a moment ago. So at that highest end risk, 55 to 85% lifetime risk, it's so high that it warrants the risk associated with going through surgery. So a bilateral mastectomy, removing all of your breast tissue to prevent that from developing into breast cancer. It might also involve removing your ovaries to further lower your risk for breast cancer. And there's specifics about, at what age group you would do that, relevant to the exact type of risk that you have and what mutation you would have. Anna is asking, at what age group would we suggest beginning the use of risk scales for breast cancer? Well, it's really the most relevant once a woman gets into adulthood. So you can do it at age 18 to 20. I probably wouldn't do it beforehand. It's not as meaningful, particularly once we get into our 30s. We don't usually do mammograms prior to the age of 30, even if you have risk factors. And so what we do with the risk score isn't as significant until you get beyond that. If you were 20% or higher risk, though, and there was very early age onset of breast cancer in your family prior to the age of 35, as an example. So if you were 20% risk and lifetime risk, and your sister had breast cancer at age 35, that person actually might be a candidate to, if she were high risk, to start breast MRI as early as age 25. So it kind of depends on the scenario. So, definitely, if someone's interested, they could start as early as age 18 to 20 would be the earliest, I would say. That's a really good question. So we finished talking about the surgery part. So let's move on to lifestyle. So the two biggest bang for your bucks in terms of lifestyle modifications is exercise and weight. So simply by adding 150 minutes or more of just brisk walking to your lifestyle can really, in a meaningful way, lower your risk for breast cancer. So it's an easy way, and there's no amount of exercise that's too small to start. And so even starting with 5 or 10 minutes several times a week and gradually building it up can make a difference. Managing your weight, trying to get your weight out of that obesity range, which is a body mass index of 30 or higher, is most significant, but really losing any amount of weight is going to help reduce your risk for breast cancer. As I said earlier, it's really meaningful once you're in menopause to try to prevent significant weight gain, because that has a meaningful effect on breast cancer risk. Nutrition. So let's talk a little bit about how eating affects breast cancer risk and the things that we can do to lower breast cancer risk based on that nutrition aspect. So the first thing is increasing the amount of colorful fruits and vegetables in our diet. So increasing antioxidants. These nutrients have a protective benefit against cancer. Specifically in the arena of veggies, though, there are a grouping of vegetables called cruciferous vegetables or brassicae vegetables. And these are the vegetables that include things like broccoli, cauliflower, kale, cabbage, Brussels sprouts, things like that. And there are ingredients in this particular vegetable that have a significant impact. If we eat them regularly, they can be very powerful in helping us to reduce breast cancer risk. Not that you need to eat all those foods every day, but choose one of those out of those food groups and try to include at least a little bit in your diet most every day. Ground flaxseed is another specific food group that's actually been studied, and there's a study that actually showed a really impressive result. If we try to get a couple of tablespoons of ground flaxseed into our diet on a daily basis, there was actually a Canadian study that showed that we could impact our breast cancer risk and reduce it by up to like 30%, I think the study showed. So just a really meaningful impact. Trying to include healthy fats in our diet, like olive oil, nuts, avocados, cold water fish like wild salmon. These omega-3 fatty acids have lots of health benefits, but they also have the added benefit of helping to lower breast cancer risk. Following a diet that has anti-inflammatory foods in it. So like the Mediterranean diet, I think is a wonderful, fun diet, and it does tend to lean more towards an anti-inflammatory type diet. But things like drinking green and white tea, including ginger and turmeric in your cooking and baking, is a good way to include anti-inflammatory foods. Getting adequate vitamin D as part of your diet is a really important aspect. And the ways that you can do that is getting a little bit of sunlight. Most women do need to supplement with vitamin D. So a good dose that I usually have my patients take is 2,000 international units of vitamin D per day. It's very tough to overdose or get too much based on this level. You could also get your level checked. We don't necessarily know that supplementing with vitamin D lowers breast cancer risk, but what we do know is that women who eventually develop breast cancer, if they have a vitamin D deficiency or even on the lower end of normal, they have poorer survival outcomes from breast cancer. So it's really important for lots of reasons to have adequate vitamin D, both for bone health, but also to get the benefit of potentially doing better relative to breast cancer risk, or having better survival if we do develop unfortunately, breast cancer ourselves. Limiting or avoiding alcohol and tobacco is a really important aspect. As I said a moment earlier, there isn't necessarily a safe amount of alcohol. It's optimal to avoid. If you really enjoy alcohol and enjoy, several ounces with your dinner at night, I think limiting it to several nights per week is a good idea, rather than having it every single night. So those are the biggest things with nutrition. I think, I tend to focus more on educating people about what to eat rather than what to avoid. But if I were to throw out just a couple things about what, the things that, you don't want to have a ton in your diet to have a health benefit in terms of breast cancer risk, I would say that it's, minimizing trans fats in your diet, processed foods, and simple sugars. And that's just going to carry you into a healthy diet for lots of other health benefits as well. Just looking to see if there's any other questions, and I don't see any other further questions. So I just want to end tonight's discussion by just summarizing tips in terms of things that you really want to focus on in terms of this topic. So know your family history. Obviously, if there's a family history of breast and ovarian cancer and you don't know it, then you're going to not have this information to be able to determine your risk level for breast cancer and maybe not optimize the options that you have for screening. The second thing is learn your own personal risk level for breast cancer, either simply knowing the risk factors as we've discussed tonight, or getting a risk assessment done. The Gail model is an easy one that you can log on to online and do that. I think we can maybe post the website for the Gail model breast cancer risk assessment. If we could do that, that's an easy one. I see it posted there. So you can do that yourself. The Tyrer-Cusick risk model is one that we use more in the office. It's a little bit more complex and it isn't as user-friendly to do on yourself. But know your risk level so that you can maximize your ability to make good choices that are right for you and have the most appropriate screening that's right for you. Get your regular breast cancer screenings done, and this is based on what your risk level is. The minimum is to have an annual mammogram starting at age 40. Eat a healthy diet and get regular exercise to keep body weight in a healthy range. And we talked about some of those nutrition aspects. These are really important. They're simple tips, but they can make a big difference. And the last thing is live in balance. It doesn't make sense to live stringently using a strict diet and exercising at a level that you're not having fun with life anymore. So it's important to take all of these things in balance, and hopefully the things that bring you joy have, some healthy aspects to them. But live in balance, have gratitude, find joy and meaning, spend time with those you love and care about. And so living in balance is the key to healthy living. So thank you so much for joining me tonight. I've so enjoyed sharing some of my knowledge in this area with you. If you want to join and become a member at True Women's Health, please log on to our website at truewomenshealth.com. We would be thrilled to have you join us. Until next time, stay in good health, and hopefully you'll take some of these tips and move towards reducing your risk for breast cancer. Thank you. Have a wonderful evening.